I'd like to take a quick look at some of the most frequently asked questions about subthreshold awareness, including what is the subthreshold awareness method, and what makes it so different from conventional methods of assessment, and also what unique benefits and advantages can it provide for practitioners. Most practitioners recognize the fact that their nervous system detects much more information than what they're consciously aware of. And this is one reason practitioners often spend time developing their attention and perception skills, so they can become aware of more of the information that their nervous system is detecting about a patient. The subthreshold awareness approach provides a way for practitioners to quickly increase their effective range of perception so they can become aware of important changes in a patient's physiology that are too subtle to be detected using standard methods of assessment. What makes the subthreshold awareness approach so different from conventional methods of assessment is the way a practitioner directs their focus of attention. When a practitioner uses a conventional method of assessment, they generally focus their attention on the sensory responses which their nervous system produces when it detects a stimulus coming from a patient. So, for example, somatic practitioners typically learn to focus their attention on subtle tactile sensations, which are produced when they assess the patient using palpation. Now, this standard approach of focusing attention on subtle sensory responses is a time-honored and effective means of assessing. However, it has significant limitations. So much so, in fact, that if a practitioner uses only conventional method of assessment, they will miss out on essential information that their nervous system is detecting about a patient. And here's why. A practitioner's nervous system will produce a conscious sensory response when it detects a stimulus coming from a patient, as long as the stimulus is strong enough, which is to say it's above a certain threshold of intensity. If, however, the stimulus from a patient is so weak that it falls beneath the threshold, that is, it's a subthreshold stimulus, the practitioner's nervous system will not produce a sensory response about a subthreshold stimulus. Therefore, a practitioner will not be aware of subthreshold stimuli coming from a patient if they only use conventional methods of assessment. And that is a significant oversight, because contemporary neurosciences have conclusively demonstrated the fact that the human nervous system detects substantial amounts of information at the subthreshold level. Moreover, recent studies have shown that the nervous system produces one set of responses when it detects a standard stimulus, and it produces a markedly different set of responses when it detects a subthreshold stimulus. Researchers have identified a number of specific responses that the nervous system produces when it detects a subthreshold stimulus. The subthreshold awareness method teaches practitioners how to selectively focus their attention on specific responses which their nervous system produces when it detects important subthreshold stimuli coming from a patient. So, what type of benefits can a practitioner look forward to if they integrate a subthreshold approach into their practice? Well, the primary benefit is they'll become aware of important changes in a patient's physiology that are too subtle to be consciously perceived using standard methods of assessment. And this important supplemental information contains key insights that can significantly enhance both the specificity and the efficacy of a wide range of corrective techniques. Also, when a practitioner is able to consciously perceive dysfunctional changes at more subtle levels, they can intervene at earlier stages in the dis-ease process and thereby provide more preventative type of care. And as you might expect, practitioners customarily experience a much greater sense of certainty in their work when they're able to get access to this essential type of information. Furthermore, the subthreshold awareness approach prompts practitioners to experience and explore more of their innate abilities while they work with their patients. And practitioners report time and again that they find this personally to be a very rewarding way in which to practice. And finally, The subthreshold awareness approach evolved out of ongoing neuroscientific research into perception, and therefore it includes a number of groundbreaking discoveries which make it possible for practitioners to develop advanced perception skills in a fraction of the time that would be normally required. With proper instruction, most practitioners can learn to use subthreshold awareness skills in a single weekend.